When it comes to making improvements in rural health, it really does take a village. Solving complex challenges requires multifaceted inputs, leveraging insights from the work and collaboration among service providers, community leaders, philanthropic organizations, and government agencies. With this collective knowledge, changemakers can begin to analyze why previous solutions may have fallen short and how to ensure future solutions succeed. From an earlier episode in our podcast series, we learned that rural providers are often up against resource challenges, including funding, technology, and personnel. Many look to partner with other entities or organizations in order to fill gaps and better serve their local populations. Coming together to solve serious challenges has long been a key approach in rural America, but the ways in which partners work together continue to evolve. In this conversation, we take a multi-sector perspective on cooperative efforts to meet the unique needs of rural communities. I'm Dr. Erica Rogan, a director in Federal Healthcare Advisory at KPMG, and host of this edition of Framing Health's Future, an initiative from the federal health leaders at KPMG. I'm so pleased to have Dr. Kara James with me today to discuss collaboration to improve rural health. Dr. James is the president and CEO of Grantmakers in Health and previously served as the director of the Office of Minority Health at the Centers for Medicare and Medicaid Services, or CMS. Thank you for joining us for this conversation, Kara. I'm excited to hear about your experiences and your learnings related to collaborative efforts in rural areas and how we can make the most of partnerships to improve rural health. Before we dive into our questions, though, I'd like to set the stage a bit for our audience and describe your experiences in addressing rural issues, both at the Centers for Medicare and Medicaid Services and now at Grantmakers in Health. So can you share a little bit about your previous and current roles and how your work thus far has touched rural health?
Sure. Well, first of all, Erica, thank you so much for inviting me to be part of the conversation today. As you mentioned, I've spent some time at the Centers for Medicare and Medicaid Services, where for about 8 years I was the director of the Office of Minority Health and co-chair of the CMS Rural Health Council. So in that capacity, working across government, particularly with the Federal Office on Rural Health Policy, as well as colleagues at USDA, to improve the lives and health of communities in our rural areas across the country. And that included doing work around data analysis, looking at our rules and how they apply to rural communities and impact them, thinking about models at the Center for Medicare and Medicaid Innovation, and many other spaces. And then joined Grantmakers in Health in 2020. And coming into GIH, we already had a longstanding partnership with the Federal Office of Rural Health Policy and the National Rural Health Association to bring together rural funders and connect them with policymakers to help in service of understanding, bridging those gaps, and again, supporting better health. So we have continued that work. I joined in the pandemic, so we pulled partners together to really think about how philanthropy was supporting rural communities in their responses to COVID and those issues, and have built on that work, deepening that work through other projects that we have more recently begun to launch.
That's terrific. So lots of deep experience here that we can draw on today.
Yes.
So given this focus on collaboration that we want to talk about, I'd love to first discuss just what collaboration looks like for rural health. And from your experience, who would you say are the typical relevant parties? You mentioned a few on the federal side already. What are their primary issues that they're joining forces on, and who's involved?
It's a great question. Collaboration looks different in every community. I think that there are key principles around collaboration and what that looks like, but it can involve a variety of partners, and particularly in rural communities, those partners range across sectors because there may be fewer community groups focused on health, but you're working with education, you're working with business, you're working with other spaces. In collaboration at the federal level, it generally is across agencies. We see some partnership and collaboration, particularly, the CDC now has an office on rural health. The Federal Office of Rural Health Policy CMS, USDA, who has a lot of engagement and work in the health space in ways, particularly in rural communities. They have a strong footprint in community in a way that some of the other agencies may not have as much of. And also it works, looks with collaboration with philanthropy, with state government and local, as well as a variety. So it ranges quite dramatically.
Are there particular topics that come to mind where you see a lot of collaboration happening?
Yes, I think one of the things we know is that rural communities typically have challenge around workforce. So
Mm.
frequently there are collaborations to strengthen the workforce, to have a more robust pipeline to help connect people in different ways. There are collaborations around food and some of the nutrition issues in communities. I've seen collaborations around, which is kind of interesting to think about with rural communities and our perceptions of them, increasing access to exercise trails between schools and other communities, because in some respects those communities may not have sidewalks the way they are in other spaces, so the safety and ability to walk and navigate around the community can be a challenge. So there have been some interesting partnerships there to make the communities more walkable in that respect to improve access.
Yeah, that's really interesting that there's some things focusing on, inside the healthcare setting, like workforce, as you mentioned, but also outside of the immediate healthcare setting, thinking about built environment and social determinants of health. So helpful to see that collaboration can happen across that entire spectrum, not just
Yeah.
focused on medical services.
Hmm.
And you mentioned, Kara, that philanthropy plays a role here in collaborating. And some of our listeners might not be as familiar with the role of philanthropic organizations and how they can support rural communities. Can you talk a little bit about how health funders can collaborate with local organizations, providers, service providers in rural areas to improve health for those communities?
Sure. So I think before even diving into that, I think it's important to just also talk about the breadth of what philanthropy looks like. And so people may be familiar with a community trust in their organization, community foundation in their community that provides services and funding in different spaces. Those vary. Those typically can be individuals who've left wills and resources to support particular activities. Then you have, sort of family foundations, conversion foundations, which we're seeing as hospitals or health systems are consolidating, that there can be a foundation that is created that the state attorney general will sort of set what the focus is of that organization. So there's, for example, a rather large one in Western North Carolina with Dogwood Health Trust that is from the sale of a hospital that focuses in those communities and counties in Western North Carolina, many of which are very rural, and creating some of those resources. And then, of course, we have some of the large national foundations, such as Kellogg or Robert Wood Johnson Foundation, that people may be familiar with, who are also invested in different ways. And so what we see with philanthropy is that, as with so many other spaces, the investment in rural is typically underrepresented in some of the philanthropic dollars. So there are some very robust, innovative, dedicated philanthropies focused in rural spaces, but not as many as we would like to see.
Mhm.
And so then when we start talking about what that collaboration can look like, it tends to vary, in part because, again, what is the proximity of that philanthropic entity to the community? So a community foundation or community trust, much more proximate. They're in the communities and providing some of those resources. Whereas some of the more national and larger ones may be a little less proximate to community, but they can be supporting grants through research, through training programs. Again, some foundations may be helping to support rural residency programs and some of those training opportunities there.
So, are there different ways that areas for funds or areas of support are determined by the health funding organizations, or do they tend to have a common process to pick what community or what topic area they're going to look to support?
Typically, if you look at each foundation has a focus that is driven by their history and sort of their organizational kind of bylaws where they focus. When they
Mhm.
were established, that's what they focus on. So there's
Mhm.
trying to do that alignment, and how philanthropy has evolved over time from more direct services and support to more systemic change that people are looking up and getting upstream. How do we make that societal change that's needed? But there are some that are restricted in how and who they can fund. But it is one that is a little specific to the foundation, which makes it a little challenging because they're
Mhm.
unlike a website like grants.gov. There isn't exactly a philanthropy.org that you can go say, I'm looking for a foundation that does this, that, and the other. It's not as easy to find and would fund. So, going back, for example, some of the place based funders are restricted to funding in those places.
Mm.
So, they may support rural, but can't necessarily fund outside of their communities. So there are some constraints that some foundations have.
Sure. Very interesting. So, a lot of considerations both from the funder side as well as the potential recipient side of where to look, how to navigate the processes, and what opportunities might even be available to them given some of the constraints that you mentioned too. So, a lot to think about there. Do you see in your work that there are different types of collaborations that organizations can utilize for rural health? So certainly this funding aspect is critical. Are there other ways that the organizations you work with can support rural health?
Yeah, so one of the things that philanthropy has as a tool is the power of convening. Philanthropy is viewed as a bit of a neutral convener, and so can bring together and help set tables where conversations and learnings can be shared. And so that is something that we do see, that learning communities or learning collaboratives can be supported, so that sometimes we hear from people in rural communities they feel a little isolated in doing the work, and so that can foster those connections. So there are some leadership support that is helping to create leadership cohorts that can help train future leaders in rural communities to engage in that work. Some of the other spaces is learning. So there have been some foundations who've supported learning journeys for some tribal communities as they're trying to figure out self-determination around their health issues. So have provided an opportunity and resources for leadership from the tribal to community to go to Alaska to see, for example, the Nuka model, and to
Mhm.
see how that might be something they could bring back to their community and adapt to meet their tribal members' needs. So convening, education and leadership training, as well as that opportunity for research and support, can also be ways in which philanthropy can collaborate with communities in rural areas.
Great. So lots of different ways that collaboration can happen, especially for the rural context. But as you mentioned, maybe also beyond rural areas too, using those different types of collaboration. I'd love to now understand a little bit some of the ways that collaboration can go very well, and also perhaps not so well, because I'm sure there's been a spectrum that you've perhaps gotten to observe over time of successes and less so. So let's start with the successes. What do you think are some hallmarks of truly effective collaboration for rural health?
Yeah, I think so. One, the collaboration principles I think are similar regardless of rural or urban areas. And I think that the first is, having trust in the organizations, and that trust takes time and trust and sort of that commitment. One of the other things is truly to be engaged in listening to what the community wants. Philanthropy has a history of being rather paternalistic and saying, we're giving you these dollars to do this thing. But that collaboration where they're really successful is kind of the co creation
Mm.
and co identification of what the need is and what the solution is. And then empowering as well the community or the other entities to really have a say in it, because there is a power dynamic that we have. If you have the purse strings, then you have the power. And so that recognition of that, as well as how that can be shared with the community to have that kind of win-win, I think is an important piece. And then the other thing is that it has to be a commitment, and it is not a one-time project. And so we know a lot of communities, and again, not just rural, but other underserved communities, feel like there's this kind of swoop in, do the research project, and leave, and the information and the support isn't there. So again, that kind of commitment to the community over a longer period of time. And then the final thing that I would say is in these like successful collaborations that the learning is shared. It's not just kept at the institution, the foundation that is doing or supporting the work, but it's shared with the community so that people can also feel like they are invested in what was learned. So those are some of the things between that, listening, trust, commitment, the co-creation of and co-identification of the challenges and solutions, and real kind of that power sharing.
Such important takeaways there. And we've heard in some of our other discussions around amplifying the rural voice and having the seat at the table for folks from the community that know their lived experience the best, right? And so, such an important point, I think, that you've made there. And you mentioned about kind of getting the word out. What are some ways that health funders or philanthropic organizations can learn from one another in terms of successes or promising practices around collaboration?
We are one of those organizations that can help connect funders. We sit at the intersection of health philanthropy, and so through our convenings or sister organizations that we work with, like Grant Makers and Aging or Early Childhood Funders Network, we help to facilitate those connections across philanthropy as well. So we also have that power of convening through conferences, webinars, other programming to share that learning with that. We also try to bring community voices to our meetings and engagements so that we're hearing from the rural communities and other stakeholders to share that knowledge to get funders a little more proximate to the work as well. And so those are some of the spaces. They're also publications, so they're varying. The Chronicle of Philanthropy is a space where people can share learnings and things. There's Inside Philanthropy. There are a number of spaces that are opportunities to share findings and to be able to have some of those convenings. And then also, we can foster and do have a learning community. So we just have launched a rural philanthropy learning community with some of the innovators in this space who've been doing this work for a long time. What are they learning? What are they thinking about? And it just these initial conversations that we've had with them, I'm really excited to see where the work goes, because the things that they're thinking about are not always the same things we've heard in some of our rural conversations with others.
Mm-hmm. Great, and it's so good to hear that there's this structure around the sharing of information and convening and connecting the organizations to each other, because that's how the learning happens, as you've said. So, really important activities going on with your organization. Is there an example that comes to mind that you could share with us where you have seen some real tangible improvements or successes for a rural community, or something that really stood out to you as this is the way to do it well?
Yeah, I think, there are a couple that come to mind. Well, the one I'll start with is really a linkage between kind of trauma informed justice in tribal communities that's also tied in with supportive housing and long-term housing as opposed to short-term housing for individuals with a history of substance use. And it's collaboration that has received philanthropic support, but also in that learning, the model was something that came out of Brooklyn, but was imported into Montana. And so learning how to think about trauma-informed justice as a way to reduce recidivism and to also address those social needs in a way. And that was, it's a very, very impressive kind of model that is tribally driven, has collaboration through that philanthropic space, as well as working with government and the local, sort of justice departments there to engage. So that's one that I think about, and had the opportunity to see that as part of our annual rural road trip that we do. A couple of years ago, we went to central and western Montana. Another one that I think about is, community in Kansas that has been working to address the workforce issues in their health system. And it has relied on leveraging immigrants to come in through the visa programs and others, but understanding the need to not just bring them in, but welcome them into the community to help them to get adjusted and committed and to stay, and thinking about that as kind of the wraparound services of the families as well. And so that collaboration between community groups to help provide that welcoming, the health system, as well as some philanthropic engagement and support to bring people in, has been successful in helping to increase the workforce in that community. So those are some that immediately come to mind, but I think there are many others out there, and I think that's one of the things that's really important, is that there's a lot of great work happening in rural communities, and the challenge is to lift it up and share it, because so many people are so focused on the work and don't necessarily have the time or bandwidth to do the promotion of the work to share.
Wow. So some great examples there and some bright spots, for collaboration.
And I have to say one more, because I
Yes,
earlier mentioned the
please.
walkable, but one of the ones that I just remember hearing about, a community in North Carolina that had received some federal dollars from the Federal Office of Rural Health Policy for a school to build walking trails in their community. And they then worked with the school system to allow access to have as part of the school day, so taking class time to allow for exercise. And the individual who was sharing the story talked about not only how the outcomes improved academic performance and the health of the students, but in particular shared the story of a young woman. She had a disability, and the ability to do that walking over the course of the year allowed her to move from using a walker to basically being able to walk with just crutches and having
Wow.
much more stability. So it can make some real world difference for people in community, but that collaboration is so important and across so many areas.
Wow. Well, I asked for tangible results, and I think that is such a fantastic example of one, such a meaningful initiative to change someone's life, which is just incredible. I'm curious about kind of the origin stories around these types of collaborations, because you mentioned state actors, federal actors, communities, tribal leadership. Do you see that these collaborative efforts are intentional? Are they based off of data? Are they things that leaders have particular interests in, and that's kind of what drives it? How do these tend to originate?
It is all of the above. I think what is, a successful ingredient in all of them is strong leadership.
Mm,
And that can either be from the community really pushing and advocating, but, that partner as well. So leadership is important. These ideas, they come up, again, from community health needs assessments and identifying key issues. They come up in conversation because, again, I think that sometimes we who may not be as proximate or have the lived experience of those in community, we may know what kind of the problem area is, but may not know exactly what the problem is
mm,
or what the solution is. And so getting that feedback and engagement with the community really does help to identify what are the barriers to develop a more successful solution. And so I think about my time at CMS, where I went to Wisconsin and we were talking to some rural stakeholders, and I literally came back with floor plans because they were explaining to me that the way that we had rolled out a rule, this was the real world implication of that. And
mm,
we all could agree it didn't quite go as we had intended, and
mhm,
so could come back, explain that, and fix that. But I think that thinking about how we engage on the front end can help to develop better policies. But yes, the areas of interest come up through personal passion, personal experience, community health needs assessments, through opportunity just with grant dollars in some cases, where we're putting out dollars to support either at federal, state, local level through philanthropy, a particular focus area that people then adapt to.
mhm.
And so you could see that in the pandemic, where people were putting out dollars and communities latched on to what they needed to do. So for some people, they would take the dollars and it was about increasing broadband or Wi-Fi spaces so that students in rural communities could participate more in virtual education and schooling. For others, it might have been doing more of how do we get sustainable food options into our community and developing a food bank or so. So it
Mhm.
really is kind of all over in how these things come up, but that lived experience really does help drive.
Absolutely. And I love what you said about, differentiating the problem area from the specific problem. And the ones that know the specific problem are the community members themselves and those that are really on the ground. And being thoughtful about engaging with them sounds like such a critical input, to making that successful.
Absolutely.
So we've talked about some successes, right? And you mentioned maybe some areas where collaboration has not gone to the extent that it was hoped for. And so, how do you think different stakeholders can know when a partnership might not be working out as hoped? Are there common pitfalls that you've seen that health funders or other types of rural partners should look to avoid?
Yeah, it's a great question. I don't know that there has been as much investigation into the why something didn't work, so much as whether or not we had those results. And I think that is one place where evaluation has not always been as robust in some of the philanthropic programs as maybe in other areas. And so there are some places. Some of the things that I think can contribute to partnerships and collaborations that don't go well is again that that lack of leadership. It is really important in sort of that commitment and trust. The other thing, the communication channels. Is communication open and honest so that if things are not going according to plan, people feel comfortable and empowered to say so and feel like they will be heard and things might be addressed? Or is it just this is what we're doing and we're moving forward? I think also there are times where changes in staff, particularly in small organizations and in small communities, can be really traumatic for collaboration and things because that lost time or the ability to pick it back up and understand how you
Mm,
move forward can be another issue. And then I think just the world around us can change. And so you think
sure.
about where collaborations were in, before the pandemic hit, and then everybody having to pivot and respond to that. So just being responsive to the world around us.
Oh, absolutely. That's such a good point because at first, as you were sharing, I was thinking that okay, the pitfalls are sort of the flip side of the hallmarks of success, right? If you don't have good communication or don't have the trust, but there's also these outside forces or outside factors that can be potentially detrimental to something that was going okay to begin with. So important to be thinking about those things and, as you said, be responsive and have some freedom and some interest in pivoting when needed. I'm sure that many organizations experienced that in 2020 with the pandemic for sure. So, given us, I think, a good sense of what can kind of make or break effective collaboration. So, I'd like to talk a little bit about some of the aspects that are potentially more particular to rural areas that could be of interest for our listeners today. So, from what you've said, it sounds not uncommon for rural health collaboration to encompass many types of stakeholders. So you've mentioned philanthropic organizations, federal, state agencies, community organizations, providers, et cetera. I imagine that sometimes these different players may not always be perfectly aligned in maybe their immediate objectives, even when they might share a broader goal. So, what do you think are some important strategies or maybe considerations for finding common ground among those different players?
Yes. So it's interesting thinking about what's different in rural, that is both an asset and can be sometimes a challenge. And I think one of the things in rural communities there is a stronger likelihood that the people know each other because it's a more close knit community. That can be both an asset and a challenge. I think about one of our rural road trips where we were visiting with an organization and it was a hospital. And they were partnering with another hospital further away on workforce issues to try not to have competition to kind of
Mm,
poach each other's workforce.
right.
There was a community health center 2 blocks away, and so we asked, are you also working with the community health center? And there was no, we don't work with them.
Oh.
And I was like, oh. And it's like, it sounds like there's some personality issues there. And they're like, yes, there are. So that can, again, that close relationship can be both an asset and can also potentially be a barrier to collaboration if there are other unresolved issues. I think that, in rural communities, one of the things that we saw on another visit where we were doing a deeper dive into disability in rural communities
Mm,
is that we shouldn't actually take for granted that they all know each other. Because there are some people who don't know. So we were convening a table of stakeholders who were engaged in supporting individuals with disabilities in the community. And for a couple of people, it was like, oh, I've not met you before. What do you work on? And so that ability to connect up was also really good. I think some of the other specific things about rural, going back to rural, by definition, is a smaller population. So it also can mean that there are challenges in capacity among others to partner in spaces that may not be directly aligned with the work that they're doing just because there are only so many hours in the day.
hmm
And this could be one more thing on top of the other 4 or 5 things that they're doing as full-time jobs to begin
hmm
with.
hmm
So that can be both a challenge. I think one of the other things with collaboration is, again, in rural areas, what we have heard sometimes, the capacity for the data collection analysis, how burdensome that can be. And so thinking about how do we right size that, but also from some of what philanthropy is doing right now is, some interrogation. During the pandemic, we saw a lot of flexibilities that philanthropy allowed in terms of reporting requirements, spending, allowing people to pivot and spend those dollars, and questions around do we need to go back to how it was being done, or can we allow some of those flexibilities so that we're not overburdening partners with onerous data collection or things that may or may not really be needed or useful. So I think those are some things that we have to think about in when collaborating and partnering with rural. And I think the other piece being, again, going back to the understanding the multiple hats that people are wearing, how are we also supporting the partner to be able to continue the collaboration and be successful?
Yeah, I think you've echoed a lot of what we've heard from other rural stakeholders around that personal relationship. We've heard about, this is someone I see in the grocery store. So we have had many interactions that we can build off of. But thinking about how that can be both good and bad, depending on the scenario. As well as you mentioned around data, which I'm glad you talked about because I want to ask a little bit about the role of data there because we've heard so much about how data plays such a central role in collaboration, innovation in rural areas, whether it be collecting it, sharing it, interpreting it. And so how do you think organizations can overcome the hurdles that are potentially associated with data in order to collaborate more successfully? Is it those flexibilities that you mentioned? Are there other strategies that can be used to really harness the data in a way that's most effective?
Yes, I think there are several things. One, and it goes back to that collaboration and co-creation. So even in the beginning, and just as a general tool, we talk about thinking about evaluation at the beginning rather than waiting until the end to evaluate. So
Yes.
in the beginning, when we're thinking about that code design of the project or the program that we're doing, what are the key outcomes that people want to look at, and that there's shared agreement on those and commitment to providing that. There are also questions that funders need to kind of ask themselves around what is it that they really need to demonstrate success to their boards or their bosses or whomever that they are responsible to, and how do you sort of minimize that a little bit. Is it's kind of what's really needed versus what is nice to have, because there's a lot of data that we want to have, but what do we really need to do that?
hmm
The other thing that there have been some common conversations around a little bit more of late is shared data collection. So are there ways to align measures or reporting outcomes so that an organization doesn't have to report, generally speaking, the same thing
Mm.
4 different ways because the community health center data system wants it this way, Medicaid wants it this way, the public health department wants it that way, and the funder wants it this way. So, can we have some of that alignment? And in some cases, even could there be even a common proposal application so that you don't have to write 4 different grants for the same project, but just have that be a different way. So having a little bit more collaboration and integration across funders, an alignment that way can help to minimize some of the burden. And then I think the other piece is making sure that we support that capacity and think about, the administrative burdens of data and things and build that into grants and funding because that's not often something that is really included.
Mm-hmm. And so important because I know even you had mentioned CMMI earlier, and I know even in that space there is some focus on how can we maybe streamline the data reporting, especially for like a multi-payer kind of model, so that there is that efficiency and some ease for making those requirements happen for providers. So sometimes easier said than done, maybe. I imagine that there's potential barriers there.
Oh, yeah.
Have you seen that happen in some of the, collaborations that you've observed? Like, is there appetite for kind of coming together on that?
There's some.
Yeah.
And like generally speaking, I tell people whenever there's a question in philanthropy, it's a continuum.
Right, right.
So there are some that are thinking about that, and I think that some of the more regional local funders do a better job with
Mm,
that
mm,
than kind of when you start getting outside in kind of the nationals and others. And definitely when you're working with government, there's kind of requirements, restrictions, and things like that. So there is some, but this is a space where I think there's a lot more that we could do to help the communities we're trying to work with.
yeah, absolutely. And so beyond data, are there other ways when we think about the funding entities, whether they be government, philanthropic, commercial, foundations, things like that, are there other ways you think that their collaboration could be improved upon to better serve rural communities or other communities of need?
Yes, I think that one of the things that I've been thinking about more lately, there is a lot of activity in rural communities. There are a lot of people working in this space. So no one should feel like it's being ignored.
Mm,
That is
mm,
not what is happening. There is a lot. It's not well coordinated. It's kind of hard to find in some respects. So there isn't an easy place to find what's happening to be able to connect up. And so trying to just identify all the dots that should be on the radar and then to start connect them is another thing. So I think there's more opportunity there for that work. And I think having a shared vision around what we're trying to do in rural communities is also something that we don't see. So that co-creation of that vision of what does better health in rural communities or better
mm,
whatever in rural communities look like so that we have kind of a map, an implementation plan for how we get there. Because government can do different things than philanthropy, than other nonprofits. So how do we leverage each of our skills, capacities, and strengths to
mm,
be able to achieve that ultimate vision? And so that is one where I feel like it would be helpful if we had a clear North Star
mhm,
of where we're trying to go and what it takes to get there, and then understanding each of our roles in that capacity. So
mm,
that is one. And I think then the other thing, again, going back to the internal kind of interrogation, what do we really need in order to meet our responsibilities and be accountable to the people whom we are accountable for about being a fiduciary and making sure we're being responsible
mhm.
and judicious in the use of our resources. And then being a little flexible in that space, and working together and being able to give and take on that.
I'll mention that at KPMG we've done some research around, what is available for rural communities, and found just what you said. There's a lot of opportunity, a lot of potential funding mechanisms to support different aspects of rural life. may be hard to navigate for many providers and community organizations. And just as you said, having that kind of coordination among the funding entities seems necessary. And so hopefully there can be some movement on that going forward. I did want to go back to something that you had mentioned, Kara, around trust. You had said that it's a key factor in making collaboration successful, but the reality is that philanthropic organizations or federal agencies, for that matter, are not necessarily directly located in the community that they are seeking to serve or to provide support. So, how, in your work, whether that be from CMS or at grant makers, how do you think health funders can work to create and maintain those trusting relationships with folks on the ground?
It speaks in part to the difference in philanthropy. So those, again, some of those community foundations, they are actually in those communities.
Okay.
So they have that relationship. And so there's an ability for, some of the national foundations who may not be as proximate to community to collaborate with some of the more regional and local funders who are there, who may be more proximate. I think the other piece is going back to that long-term commitment. So we have seen some foundations who have been committed to a place for years and decades, and that helps to kind of build up that work. We've seen other places where philanthropy can be responsive and reactive, and so there's we're here now, but we're going to be moving out. And I think being clear, or at least thinking about that up front, is important, because that can also be messaged to the community in a way that can not diminish trust. But I think that is one, helping the community to understand decisions, because there are pivots that have to be made if there's a disaster that has to be responded to, if there is, some other kind of crisis, and people understand that. But I think the communication back is always important. And again, what is the community voice being used? How is it being used and incorporated into those conversations so that people feel heard and validated?
And so I think that's so important. And being transparent, as you said, upfront really sets the stage and sets the tone for the kinds of positive relationships that can come out of these collaborations, hopefully long-term ones for sustainability too. Well, I'm sure that many rural providers and organizations are interested in connecting with health funders, but might not know where to start. We talked about how there's maybe lots of options, but there might not be a central hub of information always. What would you recommend to rural leaders, particularly when they might not have a lot of grant writing resources? What would you recommend in terms of finding philanthropic partners to help address the needs of their communities?
One of the first things I would say is, as with everything, philanthropy is about relationships. And so cultivating those relationships as well. And so the first thing I would say is that nearly every state has a regional funder network, Council on Michigan Foundations, or the Appalachian Funders Network, and those. So you can start there just to get a sense of who the funders are in your state and in your place. And that's a good starting place, because those are the ones that are largely going to be funding in your area. I think one other thing, going back to our conversation about how funders pick priorities and focus in those spaces, is understanding what they actually fund. Because reaching out to a funder who is in education and you're doing housing or something is not going to be a recipe for success. But also understanding what are some of the things that they do fund. And so if it is not direct services that they fund, but they're more in upstream social determinants or so, understanding who those funders are. And then it is, which can be a challenge, getting to build those relationships, because it's not often that there's generally just an open call for grants. There are some times where that happens, but it more frequently is an invited proposal. And so beginning to kind of cultivate those relationships, which again, all of that is time. And so that can be time consuming, but it takes work, and it is a lot of relationships.
So it sounds like there is a need for some investment from a time perspective to establish those relationships in both directions. And so that's also, I think, important consideration that time spent now can really have important dividends going forward.
Yes. And I think the last thing I would say is also who can you partner with
Mm,
in kind of co-creating that project as well from the grantee's perspective. And there again, things we all do well and things that our organizations may not be as strong in. And so thinking about that partnership angle as well can help to strengthen that proposal or project.
yeah, absolutely. Kara, since you've had such great experiences both from CMS and at Grant Makers in Health, how have those different experiences that you've had in different sectors too shaped how you view collaboration?
Each one is probably taught me something different about the challenge of collaboration. I think when I was in government, I felt like we did not leverage as much the learnings of philanthropy. You think
Mm,
about there are some foundations that are 100 years old. There's a lot of learning there. Um,
yeah.
how do we bring those voices and those learnings to the tables to make sure that, again, we're developing better policy at the beginning rather than trying to fix it on the back end? I think in philanthropy, I may have underestimated how challenging it is for funders to work together. As one CEO told me, we collaborate with everyone but ourselves. And so there's, again, reasons for that. But I think that being able to do and see more of that can have a greater impact and magnify the impact of philanthropy and speaks to a better experience for the grantees because, again,
Mm,
if we're collaborating more across philanthropy, then it benefits those in community. And so we are also in that capacity able to not duplicate work, leverage dollars to have the full spectrum. And again, going back to that, what is our future vision for rural communities and how do we have that plan to implement so that we're leveraging everybody's resources and working together?
yeah.
Um,
So it's that 360 collaboration. It sounds like thinking, collaborating with peers, whether if you're the health funding organization, collaborating with recipients, and kind of all around you. A lot of being greater than the sum of the parts kind of thinking. It seems really takes place here.
Yes. And I think, then how do you, in each case, what has been consistent, I would say, is in many cases a hesitancy slash resistance to bring community in.
Mm,
And so what I would hear when I was in government was, oh, they'll be intimidated to be in a room of feds. And it's like, no, that's not actually the case. And, in philanthropy, well, they don't understand and they might be asking us to do things we don't want to do. And it's like, well, I mean, again, we can work around that. And so it's not always the case,
right.
but that has been a consistent theme in some respects. But I think philanthropy is doing much better at engaging community and in the work.
Yeah, I think you've probably given those organizations really good food for thought because in the conversations we've had with rural stakeholders and leaders, they're ready. They're ready to have the conversations. They're ready to share their stories, whether that be with policymakers or funders. And so I think they are eager to be at the table, as you said. So hopefully, receiving that can also be happening.
Yes.
As our time is starting to come to a close, I did want to ask you about looking ahead and thinking about the future. What excites you most about the potential for more collaboration in rural healthcare, whether that be more opportunities for it, better versions of it? What's exciting you now?
Yeah, I think what is exciting me now is, again, I will say I am excited to see how this learning community that we recently launched evolves
Mm,
because there were conversations about future states. And that is an important thing to think about. And that collaboration, I think we have learned over the past few years as a result of the pandemic that we do need to engage with community more, that we also need to acknowledge and address some of the systems that are contributing to the poor health outcomes that we see in
mhm.
communities. And that I think we are on an inflection point of doing things differently. And so we can't continue doing the same things that we have been doing and expecting different outcomes. But I think that I feel like we are on the edge of doing differently, which I think could really unleash and unlock the opportunity to truly make an impact in our communities. I will say at the same time, I am also challenged by how we do a better job communicating with each other in very kind of divisive times that we have. But I think that we need to figure out how we bridge that gap so that we can work together more effectively and service of our ultimate goal of better health for all.
Yeah, so important. I know that in another conversation, we'll talk about innovation. And in so many respects, collaboration is that starting point for being innovative and sharing ideas and getting creative and bouncing ideas off of each other. And so it seems like from what you've said too, and something to be excited about is that these two concepts go together very
Yes,
closely.
yes. And the flexibility that we're seeing can help to unleash that innovation and that collaboration, because when it's not so restricted that you have to do this for that, then you can have much more interesting and effective outcomes.
Mm-hmm. Well, lastly, Kara, for those of our listeners that are with us today, whether they're policymakers or advocates or funders or rural leaders themselves, what would you say is one thing that they can do to foster stronger collaboration in their own work?
I think the one thing that people can do is get out of your office, your home, or wherever you're working and go to the places and the people that you're wanting to work with. That seeing what it is in a community, seeing firsthand how that can be, and even for some of the community, taking that step to see some of the work that funders are doing and connecting in those respects. But I think for all of us, it's getting out of our comfort zones and getting out of our spaces and going more proximate to the people we want to work with.
Yeah, so crucial. You've mentioned so many important take-home messages, I think, for our audience, and you've shared so many things that can even go beyond rural communities too, of ways of working, having some humility in what we do, and opening that listening ear to others in order to come together and communicate well. This has just been such a fantastic discussion. Thank you so much for sharing what you have learned, what you've seen in the collaboration space for rural health and working with philanthropy and health funders and thinking about the role of that sector in supporting rural communities. So I can't thank you enough. Really appreciate your time today.
Thank you so much for having me. Really enjoyed the conversation.
It's clear that collaboration plays a necessary role in supporting rural communities and improving population health. Hearing about the partnership strategies and examples in the field, including both the successes and the shortcomings, has demonstrated that the opportunities are out there to tackle rural health challenges. But it's imperative that we capitalize on them in thoughtful, intentional ways. I'm so glad we were able to surface these ideas today on working collectively to achieve rural health goals. This has been Framing Health's Future, an initiative from the federal health leaders at KPMG. For past episodes, as well as how we can partner with federal agencies as they apply these learnings, please go to visit.kpmg.us/framinghealthsfuture.